Welcome to the Cheyenne VA Pharmacy. My name is Josh Hickox. I'm the Chief of Pharmacy. These masks we've been wearing for a long time for COVID. One thing to be sure of is vaccine is here, it's ready, it's available for you. If you haven't gotten your vaccine, stop by, let us know so that we can get that to you and we can get back to some normalcy. Wyoming's in the bottom 5 for vaccinated people in the state right now. And we want to turn that around, especially as in Cheyenne we get Cheyenne Frontier Days and those kind of things. These masks go away. A lot of people ask me questions about the pharmacy, ask you, why are we so busy? Really, I tell patients every single month, we fill about 30,000 prescriptions that go out to patients, veterans like you at home. On the inpatient side, we also process about 27,000 orders for the nurses to administer those medications to patients that are in the hospital, sick at the bedside there. Big questions I get is, gosh, refills. What's the best way to get my refills? Really, one of the best ways we prefer to get refills are electronically. Phone is number one. Right on the side of your bottle, you'll have a 1-800 number to call for an automated refill line. If you're tired of sitting on the call center and waiting for that next operator to answer the phone call, use that automated refill line. You can punch in your social security number, punch in that prescription number, and we'll get that medication out to you. Another option is myhealthyvet.gov. MyHealthyVet will allow you to track your medications, allow you to refill your medications, allow you to look at just your overall access to your health care from home. Even schedule appointments right there on the computer. If you've got MyHealthyVet at home and you've got a smartphone, we also have a prescription app called the RX Refill app. That'll allow you to have an electronic list of your medications right there on your phone. Provider has a question about what you're taking at home, reach in your pocket, take out that phone, you've got your medication list. RX Refill app will allow you to refill your medications, track your medications, know exactly where those medications are coming from. Outside of the phone and myhealthyvet.gov, we also have drop boxes. A lot of that paperwork that gets sent out with your prescriptions also includes a little refill slip right out in front of the building here. We have a big mailbox for just those kind of refill slips to drop off at any point in time. Those are our preferred ways to request refills from home because you don't have to wait on the call center anymore. You don't have to wait on a human. It's all at your fingertips. I also get questions about courier delays. Well, since COVID's been around, we have had some delays in the courier, but one thing patients maybe don't realize, if you're getting a 90-day supply of a medication, we actually mail those medications out starting about 15 days early. So if you request your refill, request it as early as possible. As soon as you get that medication, you're not due for another 90 days, but call us up now and we'll get that medication ready to go, ready to be processed so that at day 75, it's in the courier's hand, headed to your doorway. Another thing you might not realize in the VA is we have a team of specialists to take care of you every time you come in to see your primary care physician. You may not have heard of this before, but it's called the Pact team, Patient Aligned Care Team. They're made up of physicians, nurses, RNs, LPNs, scheduling specialists, social workers, nutritionists, but there's also a clinical pharmacy specialist on that team as well. Your doctor may notice you have a heart problem and want to send you to a heart specialist called a cardiologist. Same may be to say for medication issues. We want to get you to a medication specialist, which is our clinical pharmacy specialist. They work right down in primary care, hand in hand with your providers. And your provider and your PAC team may send you to a pharmacist for a slew of chronic diseases. They may say you have diabetes, thyroid problems, cholesterol issues, maybe even high blood pressure, and offer you to see a medication specialist, like the clinical pharmacy specialist, to adjust your medications, take care of that disease state, and get everything controlled for you. Maybe it's just concerns or questions about reactions or side effects to medications. Our pharmacy team is here to help you. So next time you come to your VA and you have questions about the pharmacy, don't hesitate to ask or share this with a friend.